anyways. Even without me asking questions, you will only ask questions, you will only answer off. So today, gentle reminder to allow me to ask questions just for the fact that I have studied. Thank you so much. So shall we go?
So you are live.
Yeah. Good morning, everyone. This is a session which is slightly out of the box, which we wanted to do from quite some time because of many requests that we received. So this is not a very conventional topic, and today we will be only concentrating on troubleshooting in the embryology lab. So Dr. Jay, who has immense practical experience in embryology and who has been a very successful traveling embryologist in the initial part of his career, will take us through the troubleshooting part. So this troubleshooting can be either like preventive, where we can prevent the troubles coming up, and or it can be something which is corrective, where we can prevent it from happening again, or it can be remedial, where we try to reduce the problems which have already occurred and try to salvage the whole thing. So this happens when we kind of find that our results are not at par with the standard results of IVF. And as we know, IVF is a result-oriented field wherein we want to give the best of the results to our patients. And when something like the results starts coming down, or if we are not satisfied with the results, then we start looking at various aspects and starts auditing. So over to you, sir. I think you can just give a brief and then I will start the questions.
No, I think you can start with the questions so I can answer the.
Yeah. So tell me, sir, I mean, what is your thing, like the key performance indicators? What do you look at? And then you think that you need to troubleshoot in your lab. I mean, is there any parameters or anything like a SOP which you have kept wherein you think that, yes, I mean, now is the time that there is some problem and I need to troubleshoot?
So now this is a call which has to be individualized per laboratory, right? But the first thing which I look at in my laboratory is how many blastocyst embryos we are forming per patient. Okay, this is my indicator. Okay, now there could be people who will say that they are doing day 2, day 3 transfers and they are getting outstanding results so for them that is not an indicator, and that is correct, right? This is an indicator for me because I'm going into exclusive blastocyst. So I need to maintain my culture conditions in a manner. I need to ensure that my stimulation is in a manner that there is no affecting the blastocyst formation rate. That is the first thing. Second thing, and it is a not very great parameter, but it can be used as a parameter provided you have standardized your drugs. Okay, it is not a parameter to be done if your drugs are not standardized. That means if you are using 1 month 1 HMG, second month second, third month third, fourth month fourth, then that is not the criteria. But somebody like me who orders for the entire HMG from the first day of the year, all right, for them it is a good criteria, and that is fragmentation of the embryos. Okay, and fragmentation of the embryos, if in case you want to judge, then the best day to judge fragmentation of embryos is on day 2 and not on day 3. All right, because day 2 fragmentation is something which is an important indicator of your lab quality, of your drug quality inside your laboratory. So that is one indicator which I follow. And see, I don't go by clinical pregnancy rates all the time, because the type of patients which I end up treating, especially because I'm doing only self-cycle IVF. So the type of patients which I end up treating are not very straightforward patients, right? They failed 1 or 2 IVF cycles outside, then they've come to us. Now when they've come to us, they are it's in their mind that now what do we do, right? And in that particular situation, we got to be very, very careful. Correct. So I don't go by the clinical pregnancy rates, or I don't go by the UPT positive rates and all these things. But that is something which you can keep in mind if you're also doing egg donation cycles or embryo adoption cycles at your clinic. Okay, so that is something which you can keep in mind. But I don't do it. Okay, as I'm telling you, I don't particularly do it.
So if you say the blastocyst formation rate, so what is that criteria? I mean, you see 3 successive patients have not formed blastocyst, or when do you retrospectively start analyzing?
So if the collection of oocytes is more than 5 for a particular patient, and there is no blastocyst embryo which is formed, okay, in the absence of azoospermia, that means in the absence of male factor, correct? That is when we start challenging our own laboratory. But otherwise, I'll just briefly tell you the key points which somebody can probably remember. okay, as far as optimizing their own laboratories are concerned. Okay, so I'll just switch the camera. Okay, see this. This is a very important part of your laboratory, the heating block. Okay, this heating block, no, lot of times people use an incorrect heating block. They don't have a temperature guided heating block. What they depend on is they depend on the ambient air temperature to ensure that the heating is correct. If here the heating is too much or the heating is too less, in both the situations, it can affect the spindle formation of the oocytes. Okay, so keep that in mind. Very important point. People often don't realize this and often make a mistake in this. Okay, the second important thing is this, the heating plate which is present on your laminar airflow. So if you look at your laminar airflows are going to be divided. Now you can see the zones into a non-heated zone and into a heated zone. Correct? This is how the division is for a laminar airflow in almost all the laminar airflows. So this heating plate has to be correctly heated. Quite a lot of times this heating plate becomes more than 37 degrees. That is not good. Quite a lot of times the heating plate is less than 37 degrees. That is not good. Okay. Lot of times people will do just like how they do for their operation theater, they'll do a swab culture for their IVF laboratory. The microbiologist will come and pick up air samples, pick up samples from the plates, pick up samples from the ICSI machine and all these things. All right. And I try to do it once every 15 days. Okay, that is because of the workload which I am handling. But if in case you are doing batch IVF, then the best way to handle all these things is not to do it once every 15 days. In batch IVF, you can do it just 10 days prior to your batch. Okay, that is just something which you can keep in your mind. Okay, the third thing is that, can you see that cylinders there which are throwing in the gas? Right, so I have double cylinders. I have cylinders which are this pre-mixed dry gas, what you can see, and behind that I have connection for central cylinders. So that means my Hera cell is supplied by central CO2. Okay, but my ESCO, that is my time lapse, is supplied by medical dry gas, and these dry gas cylinders are have to be optimized, because these dry gas cylinders, if they are not correct, then it will severely affect your embryo formation rates. Okay, so that is something which you have to keep in mind. Okay, then comes a very important thing. If you are using box type incubators or bench type incubators, whatever you are using. So I'll just show you my box incubator. Now see, this is the mink, the old mink. This is 8 years old. Can you see this bottle inside this? Can you see this bottle? Yeah. This bottle is the humidifier. Okay, this bottle will continuously pump humidified gas inside. Can you see there is some water droplets inside that? I don't know if you can see it through the camera, but this humidification is an extremely important thing inside an IVF laboratory for any incubator. Okay, which is what people often don't realize. Quite a lot of time that bottle is blocked, which gives rise to a poor quality embryo. All right, because there is no humidification. When there is no humidification, the media inside the culture plate, okay, it cannot absorb the gas inside. When it cannot absorb the gas inside, the pH of the media changes. When the pH of the media changes, then there is a big problem. The embryos will get arrested. Forget fragmentation, the embryo will get arrested. Okay, and then comes your final checkpoint, which you should probably be careful about, is your ICSI machine. See, lot of people experience problems in ICSI machines because they don't use it on their own. One embryologist will come and just move one of the joysticks here or move one of the screws here and there. And then what will happen is, once the joysticks are moved and the screws are moved, quite a lot of times, can you see this? This is your pneumatic suction. Can you see this? This is your holding pipette, pneumatic suction. Okay, it is oil-based suction. Quite a lot of times there is a bubble going inside this. People don't know how to correct it. When people don't know how to correct it, then there is a big problem. Automatically, you are dependent on the service engineer to come and do it for you, right? So these are the sort of technical points, okay, which we try to figure out on what would have gone wrong. Okay, otherwise our points are very standard. Our tips are changed for every patient. Holding pipette, injection pipette is changed for every patient. Our micro pipettes are fresh for every patient. Our bottle, once opened, is thrown, because we have a good volume of cases, so we don't really need to depend on all those things. Once the bottle is opened, the bottle is thrown. Okay, we don't keep the bottle with us. All these things are key performance indicators which we follow. okay, which you may not follow. Somebody might say that they look at the pH of the laboratory. Somebody might calculate the VOCs, okay, what is present inside the laboratory. But calculation of VOCs and all these things are very flawed. Okay, these are not particular type of things which are going to enhance the outcomes of your laboratories. They are good for laboratories where you have like a 3-door sterile zone entry and all these things. Okay, they are probably not optimal for laboratories where there is no such protocol which is being followed. Okay, and in a city like Bombay, it is very difficult to follow that protocol, predominantly due to the availability or lack of space in the city. So that is something which you are which you are supposed to keep in mind. One more thing I want to tell people is lots and lots and lots of times, see, you will have oocytes. Do you remember the type of photos which you had put up, Dr. Shilpa, of that beautiful oocytes on rec FSH stimulation? Rec FSH stimulation, whenever there is an oocyte which is generated, it is pure, ekdam beautiful oocyte. Okay, very nice cytoplasm. Correct. That is because the LH effect on that oocyte is virtually nothing. Same, if you extrapolate it to an HPHMG oocyte, it will be slightly darker. That is because of the LH induced granulomatous changes, granular changes inside the oocyte. A lot of times people complain that my oocyte cytoplasm was very granular, cytoplasm was very friable, the packing of the oocyte and the sperm was not very strong. All right, don't blame the drugs for this. Okay, this is purely inherent patient factors. Correct. There is nothing you can do to an inherent oocyte factor by changing the drug, because the drug is any which way is not acting on the oocyte, which is what people don't understand. They keep on complaining to the pharma company that your drug is bad. It is wrong. The drug is actually acting on the granulosa cells. There is no receptor on the oocyte. The oocyte simply has gap junction connection through cumulus cells. Cumulus cells are connected to granulosa cells. Got it? So there is no way in which a drug can affect the oocyte. If there is a problem in the oocyte, changing of the drugs will not help you to enhance your indicator. It is a patient factor. You got to do something about the patient factor. You need to improvise on that oocyte. You need to do something about that oocyte. You may not change the drug, because this is the commonest mistake people do. The minute their results go down, they call the company, return the batch, they say your drug was not correct. Pharma people also don't know nothing about embryology, so they say correct. The doctor said the oocyte were not good, right? And that is a key thing, because every time I speak to people and when they call me up and tell me this, sir, first I tried with this, I changed. Okay, next I tried with this, oocyte was like that. The problem is not the drug, the problem is the oocyte. So please, that should be a take home point if anybody is listening to this session. And you should not judge based on the drugs which you use. That is one. Correct. Second, I also want to tell people, lot of people have this bad habit of using isopropyl alcohol to clean the laboratory. A lot of people have this habit of using isopropyl alcohol in mixture with water to clean the laboratory. A lot of people have this habit of using a solution called oosafe to clean the entire laboratory. Correct. It is good. I'm not. अपने पास oosafe है क्या? ये लो oosafe. Right. It is lying down. Free sample होएगा शायद. Free का है क्या? Acha. So this oosafe is lying down in my laboratory. Correct. If you just see what this oosafe is made up of, all right, everything is tested, everything is very nice, and all. It is a disinfectant solution which is used for cleaning of CO2 incubators and laminar flow hoods. Okay, can you read that? It is used for that. So I'll just give you an example. In a time when oosafe was not available, correct, when people were cleaning the laboratories without oosafe, what were they using? Do you know? They were simply using hot water. Okay, that hot water is more than enough to wipe out everything, keep the laboratory clean. You want the laboratory to be even better, then on your laminar airflow there is a beautiful setting. If I go to my laminar airflow, see, there is a setting called UV. Can you read that setting? See, there is a UV light setting. Correct. Just on this UV light for 20 seconds. Just on this UV light for 20 minutes. Everybody will die inside that laminar airflow. Okay. Then keep it closed for 2 hours and then start your laboratory work. But no need to give fancy importance that, I use this solution, that's why my results are better. I don't use this solution, that's why my results are bad. Okay. So I don't think that is something which is a performance indicator. So keep that in mind. Okay. Yeah. Next, Shilpa madam.
culture conditions, I mean, how do you make sure the quality check, or what troubles can happen with the handling of culture media?
So the important thing for any culture media is how you equilibrate it. Right. So it is important to understand that whenever you close a culture media, the cap should be loose. That is the uh, most basic thing inside. The cap of that culture media should be loose. When you are equilibrating inside the incubator, okay, it should be a loose cap. Okay, that is going to allow the humidified CO2 to go inside. Okay, the media, equilibrate it, allow for some change in the pH to occur in that culture media, which will make it better for embryos to grow. The biggest mistake which people do is they use that they use that tube in which culture media is kept, and the cap is very tight, so that pink color stays pink, understanding, and then the embryologist comes and tells you media theek nahi hai. The media has not been equilibrated correctly. If you were to leave that cap loose, this dark pink will become light pink. This light pink is simply change in pH. That is why it is a pH indicator, that color. Understanding? So that color is added to show you the pH. Got it? So when you keep that cap loose, your equilibration will be better. The only place where you don't need equilibration in an IVF laboratory is on oil, because oil does not have anything any which way. So oil can be a tight cap. Just remember this, oil can be tight cap. Everything else is a loose cap, and everything else where there is a loose cap, you will do well only. There will be no problem.
But how do you manage during transport and storage?
What?
As culture conditions, like culture media, once you order, like how do you ensure that the quality is like good?
So I have my own cold room. So I have ensured that that type of mistakes on temperature fluctuation don't happen to us, at least. All right, because we have our own cold room. Now, this has got, honestly, madam, this has got no significance unless you are in a peripheral setup where you have electricity fluctuations. So if you read the ART law, it is mandatory that your lab is connected to a sine wave inverter. Correct. And the reason is because you need uninterrupted power supply with a backup of at least 4 to 6 hours. Okay. Remember one thing, if there is a power outage and if you don't open your incubator for 4 hours, nothing happens to the embryos. Okay. Nothing happens, because the amount of humidified air present inside that incubator at that point in time is enough for that embryo to sustain another 4 to 6 hours in absence of power. Correct. So usually in Bombay, such power outages don't happen, to be very honest with you. But we have I think 16-hour backup. So we have huge backup for our laboratory. It had once happened during COVID. The whole day the power supply was off due to some problem, and nothing had happened. Honestly, nothing had happened to anything. But keep that in mind. That is something which people forget. So just keep that in mind. Don't open the lid. You open the lid, you are allowing the air to escape. Keep the incubator closed in a power supply. Embryos will maintain themselves for a prolonged period of time, not to worry. And one more important thing, always do an oil overlay over an embryo. When you do an oil overlay over an embryo, all the VOCs, even if your lab is not tested for VOC, the VOCs will settle over the oil. Nothing will go to the culture. Just keep that in mind. Okay.
Okay, so what about the incubators? Like, how do you clean, or how do you manage about? See, you have box incubators, but there will be incubators which are there in the IVF laboratories. So the door openings and all these things, how do we
No,
take?
I have both. I have box and bench, both. So we use both of them, and we use this also. We use time lapse also. We use all three, madam, to be honest with you. So nothing really happens, to be very honest with you. And it's important, these incubators have indicators. So if your door is open for more than 30 seconds, it will start beeping. That is because the amount of air flushing which is needed after that 30 seconds is much higher. All these box type incubators also have 3 doors. Correct. When these guys have 3 doors, that means you are opening only a particular compartment. Okay, so that you are preventing air leak from the other compartments. Also, what we do is once in 6 weeks we do auto start for all the incubators, and after once in 4 months, every quarter basically, we do a contracon. So contracon is a complete cleaning cycle of the incubator. Auto start is just without the system, without the panel. Basically, the auto start would clean it for approximately 12 hours. So we do that basically, and that is more than enough. You don't really need to do it before every batch. or anything like that. This is because our use is such. See, you really don't need to do this if your use is not like doing 120 cycles a month. If you're not doing that, then don't do it, yeah. It's more than enough, you know.
So coming to the next point, how do you manage the sterility or infection control? Say like in the semen samples, do you have a SOP where you do a checklist of tests and then take up the patient? How do you manage that?
Like every other standard sort of IVF clinic, the triple H is tested, correct? Urine culture is done for the female partner. Urine culture is done for the male partner, and a high vaginal swab is taken for the female partner. That's about it. We don't do anything else beyond this, madam.
Okay. And so for the compliance of embryology lab, so do you run QCs? How do you do it? I mean, do you have any alarm systems in your embryology lab which beeps in when there is like a power cut or for more than like say 10 minutes or anything at all, like which is connected? See, now there are so many fancy gadgets which are connected to your phone, like you have that lab care system wherein it starts ringing. So do you have any? Would you recommend something like that? Is it helpful?
So no, it is helpful. Let me please tell to people that it is helpful. That is the first thing. Second, it has to be used if you are a standalone IVF clinic. That means if you are closing down your IVF clinic, let's say at 5 p.m. and your staff is going home and the and your clinic is locked, the doors are shut down and you are going to come back at 7 in the morning. So for that 10-hour window, you need an alarm system, right? Now we don't follow it, to be very honest with you. That is because we are a 24-hour place, right? So we have staff round the clock. Laboratory is checked by the staff any which ways every 3 hours. Even if nobody is there, the laboratory, the incubators are checked. If the panel is working correctly or not is checked, correct? And if everything, if my incubator supply is correct, it is checked by the staff and there is a reporting done by the staff internally. That is because we are a 24-hour place. So if you don't have a 24-hour system, it is good to invest in an alarm-based system where people can be notified and definitely a quick action can be taken. There is no doubt about it.
Okay, so coming to consumables, how do you ensure that the consumables are standard quality or quality check is done? And also how do you maintain the supply chain? See, I know you use mostly the Kitazato, the pickup needles and transfer catheters and all. But coming to the pipettes and all that stuff, like how do you manage that it is of standard quality? Do you stick to single company? Do you change based on your results? How do you do it?
So see, since the last 7 years, I have not changed. Okay. And I am into practice since 8 years. Okay. So I have not changed anything, madam. The way I am. Simple. I don't want to change Falcon tubes. I don't want to change cryotips. I don't want to change 300 micropipettes. I don't want to change my, microtip aspirators. I don't want to change my denudation pipettes. I don't want to change anything because we are used to mouth pipettes. I am somebody who is used to mouth pipettes. Okay. I was trained on mouth pipettes. From mouth pipettes, my students and my children have shifted on to using those manual, thumb operated pipettes. Correct. They are comfortable with that. I'm more than happy. Correct. But we have never changed it. See, I'll just show you. It's such a comedy thing. Everybody has their own pipette here. See, this is of Ankita. This is of Asha. This one is of Chitra. They've kept nothing for me. Okay. Everybody has their own manipulation pipettes. Everybody has their own micro pipettes. Everybody has their own tips which are present here. So what typically happens is once you have ensured that everybody is where they want to be, correct? Everybody is comfortable and convenient. Beyond that, you don't really need to experiment and change because these are standard labware. Okay. There is nothing which a company does separately about it. These are all manufactured in India. So nothing is done separately in this. It is just gamma irradiated and packed here.
So the ICSI mission in this past 7 years, 8 years, how many times you have had a breakdown and how manage? 2 times. So did you repair it yourself or did you have to call the service?
No. Now we have never done an AMC for the last 8 years. Correct. Really? I am an AMC free person. That's why these people hate me. right? Because I don't pay a single rupee for AMC, CMC, right? If something gets spoiled, we replace it. And we don't even ask them to replace it. We replace it on our own.
No,
So,
like, you are an embryologist yourself and you do the ICSIs
yeah,
yourself.
but if you don't have this type of facility, do an AMC, honestly. Okay, if you think you can't handle it, do an AMC. Very simple. Do an AMC.
So if you have somebody who is coming in like once in a few cases, like they may
Yeah,
not have an embryologist, they have like, 3 people who they are on call to do ICSIs.
yeah, yeah.
So in those situations, if there is a ICSI machine breakdown, I mean,
Hmm.
is it like if you have a AMC, I mean, it just gets rectified within that short span of time wherein you can still
4
send
to
it?
7 days. 4
Okay.
to 7 days after breakdown. The
Okay.
engineer will first come, assess, then he will send you an email, quotation. You will have to approve the quotation plus GST. You will pay first, then he will come with the system, then he will verify, and then he will get it sorted, madam.
So, validation, calibration, and servicing, I mean, what is your take on these things?
Must do it. I think you must do it unless you are so protocol driven that you don't need it. But I think you must do it. I think one must do it, is what I think. Okay.
Okay, so we'll just take these few questions in the chat box. Chance of reducing fragmentation of the embryos?
Do excellent ICSI. Exposure time of the oocyte outside should be less than 1 minute. We try and finish off ICSI once the sperms are aspirated, okay, in less than 2 minutes. Even if there are 20 oocytes, we will aspirate 20 sperms together and do ICSI cut.
And trigas cylinder, when do you change?
Once it is finished, I mean, once the pressure is less, we have 2 backup cylinders. So we have 3 trigas cylinders at all point in time. Ek khatam to dusra will be supplied by the time this gets refilled in 2 days or so in Bombay. But we have 2 backups at any given point in time.
Do you change humidifier bottles?
Once in 3 months, once in a quarter. 400 rupees, the cost.
Okay. And cleaning of live incubator, you told. High-lace, how many seconds?
10.
Hot water, how much to boil?
How much to boil? Boil. Just put will come now. What else? But don't boil. No. Don't laugh, Shilpa, madam. You should not boil the hot water. I'll tell you what you should do. You have that in that that garam pani ka that jug, no? What is it called?
Water kettle, electric.
Kettle. Electric kettle jo rehta hai na? Okay, that is enough. Understanding. If that is uska alarm agar band ho gaya, that is hot enough. You don't have to burn people around.
You can't say that. Okay. So do you use goggles to put LN2?
Sorry?
Do you
Goggles?
use goggles to put liquid nitrogen?
Which goggles, madam?
I don't know. Somebody has asked. I'm asking you.
I don't know. Eye injury ho. Ayo, liquid nitrogen is going to go in that वो flask में से नीचे जाएगा ना? How it will come to the eye?
Eye injuries are known, I believe, like,
Don't know. Fortunately, I have specs, so nothing happens.
Oh, you change it. You refill it, is it?
No, I have not seen. I have not seen how they are filling liquid nitrogen since 5-6 years. But no injury has happened. Nobody has become blind here.
Yeah, good. I think, I think I'm done. So anything you want to add? Because I know, I mean, you're more hands-on.
So I want to tell people, you should be careful about your IVF laboratory, but don't be super careful. I mean, don't be that
Paranoid.
क्या बोलते हैं? हाँ, don't be that fussy guy that शर्ट का ऊपर का बटन बंद करके अंदर अबे, nothing like that works. पता है क्या? It's good to follow that, wear autoclave clothes and all these things. It is important. But if you are very fussy, इसके बिना I will not let you enter, shoes, socks भी निकालो, perfume मत डालो. I mean, I don't put nail polish, but I have heard people, okay, nail polish भी नहीं डाल के. No, don't laugh, Shilpa, madam. It is important. I've heard this, right? People should not put nail polish and ठीक है यार, I mean, how will the embryo know who has put nail polish? ठीक है, and any which ways it is covered with oil. और वो nail polish में कहाँ से VOC निकलेगा यार? So see, that is a little bit too much. Okay, is what I think. But you follow the protocol very nicely. We are not cultivating stem cells, bhaiya. If you are cultivating stem cells, then it is a different story. You can't have, your air should be 0 VOC so that the culture doesn't get infected with air particles, bacteria. Understanding? It is really not like, it is not transplant ICU. I have seen transplant ICU. I work in transplant ICU, so I know how it is. Okay, कि transplant ICU में कितना important है to maintain system because of the immunosuppression. It is not because of the doctor or the patient. It is because of immunosuppression. So you don't want air particles to go and infect that patient. Understanding? It's not that you are going to infect. By that logic, no, you should autoclave yourself before entering the laboratory. ऐसा थोड़ी ना चलता है. So don't be so paranoid is what probably I think. Otherwise, see, please remember, gynec practice without IVF laboratory is not going to function after 5 years. So everybody will have to either tie up with an IVF lab, even if you are doing 5 cases a month, or you will have to have your own IVF lab if you are doing 10 cases a month. Pakad ke chalo. For people who are doing more than 30, 40, 50 cases a month, it is not going to be a joke. It's a great achievement in today's time and age, where people are, not going to pull in so many numbers because there are so many people doing the same IVF. ऐसा कुछ, I am not putting embryos with my left hand and somebody is putting from the nose. ऐसा कुछ भी नहीं है. Understanding, everybody's embryo is going in the endometrium only. ठीक है. So in such type of situations, okay, you have to ensure that you have a good system in your place, which your staff can manage, okay, which your maushis can manage, which your mamas can manage, correct, equally well in your absence, okay, and patients are happy. That's it. Isse zyada is doing like khujli, and I personally think all that is not required. That is my opinion. I reserve the right to be wrong. I reserve the right to be challenged. And obviously everybody has their own protocols. There are people who are doing IVF 30 years before I was born. So they have their own, because they have seen a different era. I am a very big fan of Dr. Jatin Shah. I don't know how many, if people don't know him, you must know him. Okay, he's one of the best IVF consultants India will ever see. Okay, that is because he used to prepare his own media in his laboratory. I've seen that. Okay, the reason why I respect him is because he's such a good embryologist. Okay, he used to prepare media. In that time, no commercially available media was not there. They had to prepare the flask and the media and concentrate the media and then culture the embryos inside that. You speak to Jatin sir if people want to learn the basics of IVF. Understanding, no? So Jatin sir is from that age. He's been doing IVF since that age. His results are probably the best, at least in the city of Bombay. Correct, no? He's consistently getting 40-50% IVF success rates since 25 years. So if somebody is getting that, that means he has simplified his laboratory. Okay, it is not that he has made his laboratory complex. Call him up. I will share Jatin sir's number. Call him up and tell him, sir, I want to visit your place for 2 days. He'll say, come. Okay, because there is no, you are not entering a classified military zone inside his laboratory. Okay, it's a beautiful place. Go and learn. And when you learn and when you realize, he has made it so simple, which is why he's so great. Okay, so if you want to incorporate that, I try to incorporate that. Okay, in my laboratory, that I will want to become like how Jatin sir does. Understanding? So of course you may have your own stalwarts, right? I am respecting Jatin sir because I have grown up watching him. Somebody might respect Shilpa madam, somebody might respect somebody else, somebody might respect Padma Priya madam, whatever it is. You choose your own star and you try to follow that, but you make it simplified. That is my message. Okay.
Okay, done. Thank you so much. I think it was wonderful to hear from you, from your experience. So we'll take the troubleshooting in protocols in the next session. So this was
okay, boss.